If you have Crohn's or ulcerative colitis, your medical team has probably mentioned the word biologics, and specifically a drug called Infliximab. If you're like most of my patients, hearing that you need to go to the hospital for an IV drip sounds terrifying. It feels like a massive step up in your disease. But what if I told you that this specific medication could be the key to getting your life back without relying on a handful of steroid tablets? I'm breaking down exactly what Infliximab is, what happens on your very first infusion day, and the honest truth about side effects and how effective it really is. Hello everyone, I'm Dr. Kapil Dhingra. Welcome back to my channel. Let's get into it. So, what exactly is Infliximab? Infliximab belongs to a group of medicines called biologic medications. Biologic medications are made by a biological rather than a chemical process, and they are produced in a lab by living cells. Specifically, Infliximab is an antibody-based medicine that targets a protein in the body called tumor necrosis factor alpha, or TNF. TNF alpha is naturally produced by your body and helps fight off infection. But too much TNF alpha can damage the cells that line the gut. That's what happens in IBD. And Infliximab binds to TNF alpha, blocking its harmful effect, which blocks inflammation. It is used to treat adults and children from 6 years of age with moderately to severe active Crohn's or ulcerative colitis. The aim of using this medication is to try to get your condition under control, which is known as being in remission. Let's look at the data. After 1 year of treatment, 38% of people taking Infliximab had their Crohn's under control in remission, compared to only 50% of people not taking it. For ulcerative colitis, 29% of people taking Infliximab were in remission after a year compared to 15% on placebo. But I'll always be honest with you, Infliximab doesn't work for everyone. Your IBD specialist will check how well it is working for you. How do you take it? You'll first take Infliximab through a drip into a vein in your arm, known as an intravenous infusion. You'll be treated as a day patient. You won't have to undress, get into bed, or stay the night. Your first infusion usually takes about 2 hours. You'll usually be given 5 milligrams of Infliximab for every kilogram of your weight. You'll have a second one 2 weeks later and a third infusion weeks after that. If you respond well, you'll put on maintenance dosing of an infusion every 8 weeks. Some hospitals may offer the option for adults to take it by an injection using a pre-filled pen or a syringe. You'll then have 120 milligram injection every 2 weeks. If you do injections at home, try taking it out of the fridge about 30 minutes before you inject it to let it warm to room temperature. You can also put an ice pack on the area for 2 or 3 minutes to numb the skin before you inject. Because this medicine affects the way your immune system works, you may find that infections affect you more than they used to. Before you start, your IBD team will ask you questions and do some tests, including checking for tuberculosis, past infections, HIV or hepatitis. They'll also check for heart problems, as it could make heart problems worse. Around 1 in every 10 people taking Infliximab may have infusion or injection site related reactions, flu or respiratory infection, tummy pain or headaches. To protect yourselves, wash your hands regularly with soap and water. Practice good food hygiene by avoiding raw eggs and undercooked meat or poultry, and take care in the sun wearing hat and high factor sunscreen. You should not have any live vaccine while taking Infliximab. Having annual flu and COVID-19 vaccination can help protect you, and these are safe to take because they are not live vaccines. If you're thinking of having a family, Infliximab is generally considered safe to take during pregnancy. Research shows that it is unlikely to affect your pregnancy or harm an unborn baby. However, taking Infliximab during pregnancy may affect when your baby can have live vaccine. You may be told that your baby should not have live vaccine until they are between 6 and 12 months old. Starting a biologic is a big step, but it could be the exact treatment you need to take your life back from Crohn's or colitis. If this video helped clear some of your confusion, please hit the like button, drop your questions down in the comments, and don't forget to subscribe for more expert gastroenterology education. I'll see you in the next video. Thank you.